Welcome, and thank you for attending this training on Stories from the Field, Marketing Struggles, Successes, and Strategies, sponsored by the Center for Chronic Disease Prevention and Control at the Maryland Department of Health. My name is Sue Vaith, and I'm very pleased we're able to bring this training opportunity, or bring training opportunities such as this to all of Maryland providers of evidence-based programs. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Today's webinar is being recorded. By continuing to participate in the webinar, you're consenting to be part of the recording. You will have the opportunity to submit questions to today's presenters by typing your questions into the Q&A portion of the control panel. You may send your questions at any time during the presentation, and we'll collect them and address them during the Q&A session at the end of the presentation. When it comes time to conduct Q&A, you may also click Raise Hand to be unmuted to ask a question verbally. Upon completion of the webinar, we ask all participants to please complete a short evaluation. This evaluation should pop up automatically on your screen, and the link to the evaluation will also be sent out in a post-webinar email. You will receive a certificate of completion for today's webinar after completing the evaluation. The Center for Chronic Disease Prevention and Control is part of the Prevention and Health Promotion Administration at the Department of Health, and this is our mission and vision. So I wanted to take a moment to let you know of the resources we have available in our center to help you manage and sustain your programs. Aside from this and other past and upcoming trainings, such as motivational interviewing, providing compelling group sessions, and marketing, we provide sister websites, BeHealthyMaryland.org and the Workshop Wizard. The Workshop Wizard is a HIPAA compliant site that helps you publicize classes, manage referrals and feedback to physicians about how participants are doing, manage data, and assist with billing specifically for the diabetes prevention program. Our center also provides periodic funding opportunities for evidence-based program providers to expand their programs and to other community-based organizations to develop new evidence-based programs. We have a diabetes prevention network that meets quarterly via webinar and in person, and are planning the same for diabetes management providers. And this webinar, as I noted before, is being recorded and will be available on our Be Healthy Maryland Partner Resources page and in the Help section of the Workshop Wizard. If you want more information about any of these resources, please contact me at sue.vaith, that's V-A-E-T-H, @maryland.gov. I'll now turn it over to our facilitator, Hannah Harold.
Thank you, Sue. As Sue said, I'm going to be facilitating today's webinar. We're really lucky to have two speakers with some great marketing experience to share today. Today's webinar is meant to be interactive. Each speaker is going to have about 15 minutes to present some background information on their evidence-based program's marketing efforts, after which we'll move into an open discussion and accept questions from participants. If you think of questions throughout the course of their presentations, please feel free to submit them via the question and answer panel, or you can send them into the panelists via chat, and I'll make sure those questions are addressed as well. Some of the learning objectives we have for today are a brief review of some key marketing terms and metrics, and then keeping those in mind, recognizing how these marketing terms and metrics actually apply to marketing examples or real-life marketing examples. Also understanding how marketing efforts have been implemented in other evidence-based programs from the speakers you'll be hearing from today. To seek out additional perspectives on marketing for evidence-based programs. Hopefully through the course of this webinar, you'll develop some new ideas on how you can market your own evidence-based programs. Now, before we begin, we do have a quick polling question, or two polling questions. We'd like to collect a little bit of information from our attendees. So I'm going to go ahead and launch the polling questions. The first question is about what evidence-based program you're affiliated with. So you should be able to vote on the poll now. It should be on your screen. Please go ahead and complete the poll indicating which one or more evidence-based program you're affiliated with. And then the second question just asks about what your specific role is within that program. If you're a peer leader, lifestyle coach, educator, coordinator, or some other role. And now if you're typing other, please in the chat feature, go ahead and send a message to us and just let us know, what program you're affiliated with or what your role is. If you're checking the other box, we'd like to hear a little bit more information about your program or your specific role. And I'll leave this open for about 30 seconds so that everyone has a chance to complete the poll. It looks like we've got a really good variety of people from all different types of evidence-based programs and all different roles within the program. It's a pretty good balance on the webinar today. Okay, well, I'm going to go ahead and end polling. It looks like we've gotten most of the responses. Feel free to continue to type responses into the chat box throughout the webinar if you haven't had an opportunity to do so yet. So before we dive into the presentations from the speakers, we're just going to review a few marketing terms. Now, if you were on the part 1 webinar of this marketing series a couple weeks ago, you may recognize these, but a few marketing terms to keep in the back of your mind as you listen to the speakers today are a message, which is the what, or what is it that you're telling your audience. The media, which would be how you're sharing your message with your audience. And a channel, which is the where, or where are you sharing your message. Just to give an example, if you look at flyer for diabetes self-management education and support, the message is that you can thrive with diabetes. The media type is a flyer, paper flyer, or handout. And the channel where they might be sharing this message could be at doctor's offices or at community centers or other places where they're leaving these flyers. And these are just key things to keep in mind as you're listening to the presenters today, to recognize what is the message they're sharing, what media are they using, what channels are they using, and which of these might you be able to use in your own program. And then lastly, a few marketing metrics that we did review in the marketing webinar. So for those of you who weren't able to attend, reach, when you're talking about marketing, reach is the number of people who have an opportunity to see or hear your message. That's the total potential number of people. So if you're advertising on the radio and there's 1,000 listeners, your potential reach is 1,000. The exposure is the extent to which your audience has engaged with your message or how frequently they've seen or heard it. If you're driving down the highway and you see a billboard and you see it every morning on the way to work for an entire week, you might be exposed to it 5 times. And then the awareness is the extent to which your audience knows about your campaign or its messages. So everyone can think of a little marketing jingle or tune that they have memorized because they've heard it so many times. They have high awareness. So listening to the speakers, keep in mind what marketing efforts they're doing and how they might impact reach, exposure, and awareness. So with that said, I'd like to go ahead and introduce the speakers for today. We have 2 great speakers. Beverly McHugh, registered dietitian, and she is a diabetes prevention program coordinator and lifestyle coach from SCL Health Medical Group. Our other speaker is Dominic, I'm sorry if I pronounce this wrong, Dominic, you'll have to correct me, but Duhamel, and he is a master trainer and peer leader for a chronic disease self-management program. And as I said, each of them will be taking about 15 or so minutes to present a little bit about their program and marketing efforts, and then we'll be moving into some question and answer sessions. So with that, Beverly, I'll go ahead and hand it over to you if you want to start with a little bit of a background about your program, and then we'll go into the struggles, successes, and strategies for the future that you have for marketing.
All right. Thank you, Hannah. So I live in Billings, Montana, and in the state of Montana, we started diabetes prevention programs with some money that came back from tobacco money that went back to the states as a result of a large lawsuit. And the state of Montana decided that they wanted to direct some of those funds towards chronic disease prevention, i.e. diabetes prevention and cardiovascular disease prevention. So that's how our programs got started. We were one of 4 original sites in Montana. And we had a contract and continue to have a contract with the state that we will serve 100 participants a year in the diabetes prevention program. Currently there's 16, I think, or 18 sites across the state. So when we first started, we started with absolutely nothing. We had, no office, no phone. We decided to establish a collaboration. So our hospital, St. Vincent Healthcare, collaborated with the local YMCA, and we decided to have actually our site there so that we could coordinate with their expertise on increasing physical activity along with the prevention program for making the behavior changes. So our office is actually housed at a Billings YMCA, and they graciously let us use the facility, and then we pay them for coaching time for the participants to get physical activity. When we originally started, we did kind of some media things with television, hey, this is new to our community. And that was really, we just started getting phone calls like crazy. However, it's interesting to note that as we became established, that same form of TV communication didn't seem to generate the referrals. And I don't know why that is, other than, maybe people heard that this is new to the community. Back in 2007, that term prediabetes really wasn't even used much. So it's been really interesting to see how that terminology is very more predominantly used. And of course, physicians and other healthcare providers use that term and are looking for that specific diagnosis. But when we started, there's many of these sites across the state of Montana, and different ones called themselves different things. Some of them called themselves Healthy Lifestyle Program, that kind of thing. And I know when we started, I think thinking about what you call your program might be really a good consideration if you haven't named your program already. Early on, I think having ours be a diabetes prevention program kind of almost hurt us, because people heard diabetes and they said, well, I don't want diabetes, I don't want to go there. They didn't hear the prevention part. But now I think when people are more keyed into prevention and diabetes prevention, I think it's actually a good thing. It's created an identity for our program about exactly what we do. So I think that's kind of a little interesting twist to think about what you call your program. But anyway, that's, I guess, us in a nutshell. I'll let Hannah start asking some of her questions.
No, that was great, Beverly. So I'd love to hear about how you were successful, or it gave you a big influx but then died out. What are some of the methods that have been really successful for you, or partnerships you've made that have helped?
Yeah, so I think first of all, you have to kind of look at, are you marketing to your general community, and how is your program set up? So our program is set up that we need a physician referral. That's just the way the state of Montana does it. We're a healthcare-based system. And so each participant actually has to have a signed referral showing their labs, and we collect labs on diabetes, fasting blood sugar, A1C, as well as cardiovascular risk factors, blood pressure, and lipids. And so, I think thinking about if you're a program that requires a doctor's referral, maybe you're going to market the doctors more heavily. If you're a community-based program where you're trying to get people who think they might be at risk, your marketing efforts might be a little different. So what's been interesting is I've noticed that when you get a participant from the community who is interested in your program, they're very highly likely to enroll. When you get a doctor's referral, they're probably a little less likely to enroll. Now, I don't have any hard facts on that, but we actually have our doctors pretty well familiar, or a lot of them, with what is prediabetes, who they should be referring to our program. And so now I think they're more routinely telling people you should check out this program, and they're sending a referral, and we have that all set up in our electronic medical record. But this last time, I'd say we had gosh, I think we probably had 130 referrals, and we started our classes with about 57 people, and not all of those were doctors' referrals. Some of them were self-referrals. So you have to generate a lot of referrals to actually fill your classes. So getting back to kind of direct marketing to your, I guess, clients, I think it would be really important to know your community. I was really fortunate in the fact that I've lived in this community that I'm working in for a long time, and I'm just a person who's interested in what's going on in my community, so I'm pretty familiar with the agencies and all that. I was already associated with the hospital, so I knew who the doctors were. But there's a lot of opportunity for collaboration with different agencies in your community who may be able to identify people. Likewise, programs at your hospital that are promoting wellness or fitness, your cardiac rehab program, an arthritis program, that kind of thing. So I have spent over the last 10 years just a lot of time, and I think there's really no secrets. It's just hard work, just trying to meet up with different people in our community, different wellness groups, you know, basically accepting invitations to go out and talk to people about prediabetes so that I can tell them about the prevention program, or just even wellness in general. One effort that really seemed to pan out was I had to try to, I was in a group where they had HR directors of different companies in town. And so I got emails of a lot of those HR directors, and they really wanted their folks in these different employer groups to have this information. So whenever I was getting ready to enroll for a session of clients, I would direct send, you know, a little flyer that basically said, you know, do you have any of these risk factors? You could be at risk for diabetes, that kind of thing. We have this series of classes that can help you prevent or delay type 2 diabetes. And so I would send those, and I would say, you know, early on when you send them, you get a lot of people. And then, of course, you know, you're kind of marketing to the same group over and over, and it kind of slips over time. But I did that to the local school districts. I identified who the large companies were in town. And just any entity that was willing to basically distribute that information. And then the person called me directly, typically, or called our office directly. And then from there, we help facilitate the physician referral, because in our program, we need that physician referral.
And now, Beverly, do you think a lot of these outreach efforts, were they more so increasing awareness of your program, or increasing awareness of diabetes, or both?
Well, I think they're interconnected, you know. Sometimes it was just of pre-diabetes, but, you know, ultimately you were trying to fill your classes. And a lot of times people are surprised to learn what puts you at risk. So, you know, like the CDC has that risk test. If you go out to a group, you know, you can hand out that risk test. It takes 5 minutes to fill out, you know, and, you know, the statistics are 1 in 3 adults is, you know, at risk for diabetes based on the risk test, 1 in 2 adults over age 65. So, you know, creating that awareness and then telling them about the service that you offer. I mean, I think it goes hand in hand.
Great, thank you. And I guess
I could talk a little bit about the market. Go ahead.
Oh, no, go ahead.
I could talk a little bit about how we marketed the physicians, kind of on the other hand.
Absolutely. I think that's an important question that a lot of programs have.
Yeah. So again, that's just, you know, trying to actually get in front of the physicians whenever you can. That is a really hard thing to do. Their days are very busy. And some of the things I've actually physically gone out to the clinics, worked with clinic managers, said, you know, can I come out and a lot of times they said, yeah, just come out to the clinic on this day and kind of hang out. And, you know, when a doctor has 5 minutes between his, you know, patients, you can visit with him, you know, so I did some of that. Talking to the nurses that work with physicians is very helpful, making sure they're aware so they can help identify people. You will tend to get a couple what we call physician champions, you know, some physicians that are just great about sending referrals. And so they're, you know, pretty on that. I have gone and talked to different physician groups, you know, if they had like a, you know, they meet There's different physician committees, so trying to get to some of those physician committees and getting in front of those groups. The state of Montana has actually compiled data for us on our specific program. So we have really specific data about how, how much weight our folks lose, how many minutes of activity they achieve, how their labs are changing. And so one thing that our physician director said is, the doctors love that data. So eventually, if you get some data like that, you can give that back to the physicians. I think that's been actually pretty effective and caught their attention. It's a nice just one page and it's all in color. The other thing that happens that I think helps create physician awareness is we actually send a progress letter back to our physicians 2 times during the program. So when they finish their first 16 weeks, we have just a little letter. It's, hey, thanks for referring so-and-so. We wanted to let you know, become aware of their progress. And it reports, they've lost 6 pounds or whatever. They're trying to lose 15 to meet the program goals. They're working on building physical activity. A pretty simple letter, but that goes out. And, presumably we're hoping that gets in front of the physician. I know with things that maybe is something that could be sent electronically too. We don't have that set up to do that. So that goes out at the beginning and the end. And then, of course, those folks that do really well, they're going to see that. And then, of course, those folks are going to come back and, usually they have good things to say about your program. So that's kind of that, word of mouth marketing as well. And then twice a year when we're getting ready to enroll, we actually blanket the physicians in the community specifically at our facility, but there's actually another large hospital in town. There's a VA clinic, there's a community health clinic, and there's Indian Health Services as well. So we will send kind of a one page. It says refer now, and it says if your client patient has any of these risk factors and you think they could benefit from our classes, please refer to our prevention program. And we actually had a paper referral that we did before our electronic referral. So we used to staple that to that and then we'd send it. And then a lot of times I actually took the time to handwrite a note like, hey, Dr. Smith, please keep this program in mind. Anything to set your stuff out. I think people are just so bombarded with messaging, with all our media messaging. If you can do anything to make yours look a little different or stand out, that handwritten message was my attempt to do that. We actually gave little fruit early on. We gave like a little fruit basket to our doctors trying to say, hey, check this out. We're down here, just anything again to get their attention. But fortunately now at this point, we aren't doing a lot of direct marketing because we're getting so many physician referrals. Now keep in mind that took 10 years to get here. And then those physician referrals, interestingly, don't always generate enrolled participants. And they all come through an electronic health record, so we print them out. And that's a little bit of a challenge to get that all set up, but it works great. And then there's that piece where then you have to, then there's an education piece about, oh, it's in the electronic medical record. How do you find it there? And how do you fill it out? And that just takes time too. So working with somebody in your system that can kind of problem solve that, or sometimes the nurses actually will call our office and say, well, we want to send this patient, but we can't find it in the the EHR. Where is it? So you kind of have to have a knowledge of how to help them with that as well. Another little thing that we actually did early on is we have something called a rack card. It's a 5x9 card that just has information about our classes. I've actually personally delivered those to the waiting rooms of clinics. So sometimes people will pick those up and then they take them into their doctor and they say, what do you know about this? Sometimes the doctors just like to have them in their exam rooms. We also did a little tear-off pad that just, I can't even remember what it said because we don't use it anymore, but it was just sort of a little thing that a doctor could just say, hey, I think these classes would be great for you. Call them and find out more about it. And that was pretty effective too early on.
And now for that kind of marketing, were you using messages that were pre-developed by groups like the CDC or American Diabetes Association?
When we started, none of that existed. So those toolkits and things have just come out in the last 4 to 5 years. And so we basically were doing our own messaging, and we just tried to try a lot of different tacks. I think some of those messaging type statements that are in those toolkits now with CDC and stuff, I think they're great. You know, my stuff was kind of all established by the time that stuff came out, and I didn't go back and redo it. But I think those are great little idea hot pots to go in and look at and just steal that stuff and use it, because that's what it's there for. But it wasn't there when we were doing our stuff.
Great. Well, thank you. It sounds like you guys have had quite a few successful marketing efforts, but also it does take time to build up that marketing, you know, the awareness and getting those referrals.
Yeah.
I had wanted to see you raise a hand. Unfortunately, I can't unmute you because your version of Zoom is too old. If you want to type your question into chat, we can certainly address that at the end of the webinar. I think for now, do you have any additional comments you'd like to say before we move on to Dominic?
I guess one of the things that I might throw in there is when you're trying to fill a class and get your information out there, things to think about is like, where are you going to hold your class and what time of day? Because we definitely find older, maybe retired folks like morning classes. If your audience is working people, you're going to have a class at the end of the day. And so we have actually 4 classes that we hold consecutively. We do a 9 a.m., a noon, and 2 5:15 classes. And those 5:15 classes are basically working adults. And so they're not going to come if you have a class during the day. So kind of thinking about your times when you offer those classes, I think is pretty important. And then depending on your demographics of your audience too, sometimes transportation can be issues. You know, if you have maybe a Medicaid population, they're going to have a few more barriers typically in getting to class sometimes because of just economic limitations and such. So that, I guess that's something I would think about as you go to market.
Oh, absolutely. That's one of the things that we reviewed in the webinar a couple weeks ago about knowing your audience and considering your audience's specific barriers and facilitators.
Yep.
Okay, well, thank you so much. I think at this point we'll move on to let Dominic speak for a little bit, and we'll keep for questions.
Okay.
Dominic is working within a chronic disease management program. He's both a master trainer and a peer leader. So Dominic, I'll hand it over to you for a little bit of overview on your program.
Thanks, Hannah. So my name is Dominic. I am with the Wyoming Center on Aging, which is housed at the University of Wyoming in Laramie, Wyoming. I run a program called Healthy You, which is our statewide implementation of Stanford's chronic disease self-management program. We've also recently expanded to include the diabetes self-management program and the chronic pain self-management program. So those 2 other alternate programs within that suite, originally developed by Stanford and now housed at the Self-Management Resource Center. We were funded primarily by a Geriatric Workforce Enhancement Program, or GWEP grant, from HRSA at the federal level, and since have taken on additional funding for this program through a grant through the ACL, as well as a partnership with the Aging Division at the Wyoming Department of Health. So this is a statewide program. We are the central coordinating center for all CDSMP facilitators and sites throughout the entire state. So that of course brings with it some unique advantages, but also some challenges. We are a very, very rural state, which is another important thing to note ahead of time. And that very much influences how we approach marketing. I've been in this position for about 3.5 years. Which is about as long as this program has been available in Wyoming. We actually we trained our first set of master trainers at the end of 2015. So we're getting to about 4 years old as a program. And at this point, we have 54 facilitators working across the state in 19 of our 23 counties. And right now we're serving just shy of 200 participants per year. Next slide, if you don't mind, Hannah. So marketing is definitely a challenge, especially in such a rural state where often the communities we're marketing in are lower than 5,000 people in population, and sometimes we have some sites where there's only a couple hundred people who live there, and towns tend to be very distant from one another. So there's some unique challenges that come with that. In terms of struggles, you know, some of the things that we find that aren't super effective for us, and especially in Wyoming, tend to be the kinds of marketing attempts that aren't particularly targeted. So mailing flyers, for example, posting flyers in community settings. We've done some marketing via the radio. We've had some marketing done at health fairs. You know, things like that that are kind of for a generic audience, that are meant to appeal to sort of a wide variety of people. We find that we don't have a ton of luck with those kinds of marketing attempts. One of the tricky things about CDSMP and its sort of affiliated programs is that they have a really broad appeal. CDSMP in particular is for anyone who has a chronic health condition, and that's half the adults in the US. So one of the struggles that we have is we know that there are so many people, even in a small state, that stand to benefit from the program. And as such, you feel sort of compelled to market in the most broad, accessible way possible to kind of bring in as many of that really large population as we can. But with that, I think to a certain extent, if you're trying to appeal to everyone, you're not going to appeal to anyone particularly well. So I think we find in those kind of mass distributed forms that we lose a little bit in terms of a targeted approach and an approach where people can, participants specifically, can see themselves in the marketing materials. So I think one of the ways that we would, in the future, if we were to continue doing these kind of mass distributed media, I think we would start thinking about maybe sacrificing a little bit of that accessibility for something a little bit more targeted. To start within our marketing materials, trying to speak to the experience of specific groups, so that when someone, if someone sees our flyer at a community center or a library or receives something in the mail, that they see their experience reflected in it immediately, rather than a more generalized, broad description of the program that is appropriate for everyone, but maybe doesn't bring anyone in immediately. The same thing kind of goes for healthcare providers. We've done a significant amount of mailings and distributing materials to healthcare providers, and generally we find that without the kind of personal touch, without being able to sit down with them and hold their attention for a few minutes, that kind of information just generally doesn't get to them. They tend to be much too busy, and they tend to be bombarded with this sort of information. So unless you can have a conversation about it, we find that getting in touch with providers locally is not particularly effective. I think in terms of our marketing attempts that didn't work or that could have worked better, the first thing that we see as being an issue is potentially the lack of consideration for your audience, and not really considering who is on the other end and what exactly is going to keep their attention. Another, in our other marketing attempts that weren't as successful, I think the other missing ingredient in some cases was simply putting in enough effort. With these community programs, it's really tough to get people in workshops. It's really tough to get the marketing where it needs to go, especially the first time a program is being introduced in a given area. and consistently, the difference has been how much time someone is willing to put in and how thorough someone is willing to be in engaging with local community-based organizations, providers, participants, community settings, etc. And I think that's going to be the case regardless of your marketing method. But often I think there isn't necessarily a wrong door, but some avenues require a little bit more effort than others. And unless you're giving a given channel 100%, you are not likely to get a lot out of it. We can go to the next slide, Hannah. So things that have been successful for us. Again, the more targeted, the better. So we've developed sets of marketing materials that are geared specifically towards certain groups. So we have brochures and materials that are intended specifically for healthcare providers, and those things have more information about the research behind the program, the outcomes that have typically been seen in the population. It uses a bit more medical language or technical language in describing what the programs are. So that's an example for healthcare providers. We have specific sets for senior centers. We are the Wyoming Center on Aging, so we work very closely with senior centers. And these materials will be a little more down to earth, but kind of cover specifically the benefits to these programs for senior centers who get involved. And then we have separate sets of marketing materials for participants, which are, of course, much more down to earth and have messaging that is much more specific to them. And we find here the messaging is pretty important. Instead of saying that we offer classes or courses, we offer workshops. We emphasize in our marketing materials that these workshops are about teaching you to take charge of your life. We're very specific in terms of what you can expect from a workshop and what people who have taken in the workshop in the past have gotten out of it. So the goal is to be, the goal similar to the workshop itself and the program itself is to really make people feel empowered and not feel like they are the subject of a didactic course or a course where yet another person is going to simply be telling them what they should be doing and they have no real say in it. Some of the more effective media have been those that are a little bit more personal and allow for a bit more conversation. So we really emphasize and have had a lot of success with personal presentations in the lead up to workshops here locally. I will speak during lunch at the senior center. I will visit all of the support groups, the diabetes support group, the caregiver support group, the cancer support group, and tell them about the workshop, tell them about what it is, what they might expect if they join us. And this has also been an effective way of developing provider referrals that wasn't quite working otherwise. So what we've done with the provider referrals networks that we have been able to generate is we will offer to buy those providers, or the whole office essentially, the whole healthcare office lunch. And over their lunch hour, we will talk to them about our programs. We have a variety of different programs, so it's not just mine or CDSMP that we're talking about. But we'll cover our programs. We'll tell them a little bit about what they might offer their clients, and then we actually offer them referral forms that they can use if they wish to refer their patients to us. And these are generally as simple as filling out a little bit of contact information and then faxing it over to us, so that the onus is really on us to make contact with the client and discuss with them what they think, on behest of their provider, what they think would be useful to them in terms of what we have available. So again, it's all about that face-to-face and being able to have a conversation around it, being able to put a face to the name and a face to the programs, and being able to articulate in a setting where you have their attention what specifically their patients might stand to gain from it. We also find, and this is a little bit counter to what I said during the previous slide, is that here in Wyoming, the newspaper actually is really effective. It's the one kind of larger media form that we've found has been consistently effective. Part of that is that these programs are so appealing to older adults, and older adults are the primary consumer of the newspaper here in Laramie and across the state, and still rely on it pretty heavily. So I think that's kind of a unique situation to us to a certain extent, but we have gotten a lot out of that. One other thing I wanted to mention was that, and this has become really common across the nation, is that we've started offering a session 0 prior to the start of a workshop series. And this is held 2 to 3 weeks ahead of time. And this is an opportunity for people who are interested or who want to learn more to come sit and learn about what the workshop will be like, to get an idea of the various topics that we cover, an opportunity to ask questions, and we even do a little preview of one of the activities together. And this is good, I think, because in programs like CDSMP and of course other programs like DPP, the commitment is quite significant. For a lot of people, meeting 2.5 hours a week for 6 weeks is a lot of time. And, 2.5 hours is a long time to feel like you're sitting in a workshop, and committing to something over that course of time is something not everyone is eager to do. So this gives people who are on the fence or who don't feel like they want to commit without knowing if it's really appropriate for them an opportunity to sit down and learn a little bit more about it. And we've had a lot of success with that, both as a marketing tool and also as a retention tool, because people know what to expect from workshops. And so they are less likely to kind of abandon it halfway through, which has been really useful to us. So the things that make these things successful are really personal touches, the opportunity for people to ask questions, and really targeted messaging depending on the audience that we're trying to appeal to. In terms of how we measure success, we tend to focus really on our enrollment rates and our dropout rates. And in the cases where we best take advantage of these marketing methods and we get those provider referrals and we host those session 0s, we find both of those things to be significantly better. Next slide, Hannah. So in terms of what I would recommend to other programs, one thing that we've started doing, and we've started doing this statewide, is that when we are establishing a program in any area, before we even have that first workshop scheduled, we like to invite local community-based organizations, local providers, social service providers, folks like people from the senior center, people from health organizations, providers wherever possible, public health people who work at community centers, libraries, etc. We invite them to all come together and to learn about this program and learn about what role they can play in supporting it. We find that getting those folks all in the same room at the start of the process and getting them interested and getting them to articulate how they could imagine themselves contributing to this program really establishes a program for success, makes people feel invested, and makes people a lot more likely to refer people to us in the future. So I think establishing local awareness among those kinds of organizations early is really key. That's something that we've started doing and something that I wish we had started doing earlier. Along those lines, some of the struggles that I've mentioned previously, I just think being as targeted as possible and spending what time you have in face-to-face settings, or at least settings where there can be some back and forth, I think you're always going to get better use of your energy in those settings. In terms of things that we're looking forward to in the future, Bev actually touched on one of them. Providing physicians with outcome data for your programs, specifically for their clients, I think is a tremendous tool. So if you have kind of a robust data collection system and the ability to analyze the changes that have occurred among their populations, I think that can be a huge asset in engaging local healthcare providers. And I think establishing partnerships is something that we're going to continue working on. We are starting a partnership with our local QIO, Mountain Pacific Quality Health, who are going to help us notify Medicare patients of upcoming workshops in their area as they're scheduled. So we're very excited about that. And then we're also starting to promote a little bit more in healthcare provider journals and newsletters. TBD as to whether that's a very effective use of time and funds. But these are folks that are really going to ultimately make or break the success of these programs. And so I think to a certain extent among those populations, there's no real wrong way to do it. I think among those populations, the focus is really on gradually building awareness and gradually building the reputation and credibility of your program over a number of years. And again, like Bev said, it is a slow process, and it's going to take a while for them to, after seeing information about your program 4 or 5 or 6 times, it will happen. But sometimes it really takes that many exposures. These folks are very busy. They have a lot vying for their attention. And so it's important to be patient and to keep at it and to use every opportunity you have.
Thank you, Dominic. That was all very informative. One of the questions that I have for you before we move on to some larger, questions from the audience would be, you mentioned that you're getting a lot of these groups in the same room at the same time, within a community.
Mm-hmm.
How are you bringing everyone together? A lot of times getting people in the same room together is the first challenge.
Yeah, that's, well, it's not always easy. We tend to schedule these things very far ahead of time. We always try and have a voice conversation with them rather than a conversation via email. We tend to find that works much more effectively. If they're going to have difficulty leaving wherever their organization is and coming to meet us, we see if it's a possibility for us to come to them. And in the cases that someone might not be able to attend, we still try and make them feel like they're involved. We will share with them the conversations that were had among other members of the community, and what other members of the community have agreed to do to support the program, which I think kind of motivates them to do the same thing. So yeah, it can be tricky, and we don't always have a perfect success rate, but we address that problem by trying to stay flexible, by planning far ahead of time, and to a certain extent by being a nuisance. Sometimes you do kind of need to provide more reminders than someone might think is totally necessary, and engage them at a level that can feel a bit pestery. But that's our job. Our job is to stay visible, and people understand that and generally don't hold it against us. So I think that would be my response to that issue.
Great, thank you, Dominic. So at this point, I'd like to open it up to questions from the audience. I saw a couple come in. One question we've already received, and I think this would be a good question probably for both speakers, is someone, Bev, you had mentioned that within your state, diabetes prevention programs do require assigned physician referral just based on the way the state has that system set up. And then, of course, for chronic disease self-management programs, that's not a requirement. For programs that don't require assigned physician referrals but would still like to receive those physician referrals, do you think, is there any specific advice for those programs where it's not a requirement but they'd still like to get that connection with physicians?
I can go ahead. None of our programs require assigned physician referrals, and that's both a blessing and a curse. In that we don't have, to a certain extent, if you can go to a physician and say, this program requires referrals, and as such, there's these reimbursement systems in place for that, that can really help bring providers into the fold, I think. The fact that the program kind of operates on that basis, I think generates some sort of more immediate buy-in from it. But on the other hand, you become very reliant on physicians and healthcare providers to generate those referrals. And if you don't have those people engaged, then the program lives or dies by it. So for programs that don't require signed physician referrals, if you're running an evidence-based program and if you have data and participant outcomes that appeal to physicians and that physicians will see the merit of quickly, those can be used pretty easily for leverage. As soon as we tend to start talking to healthcare providers and talking to them about what the program is and the outcomes that we see in the program, they're pretty quick to recognize that this is a valuable thing, and that this is going to help them do their work and help their patients make lives easier for both themselves and for everyone involved in their care. So it's the difficulty is not necessarily in getting provider referrals, but in getting access to the providers so that they see the merits in giving you referrals. Of course, outside of that, not requiring physician referrals really opens up a really wide variety of other methods to market your programs that people or programs that require physician referrals might not otherwise have access to. Things like speaking at support groups, speaking at the senior center, really any speaking possibility whatsoever. And then things like advertising in the newspaper or whatever other kinds of media you want to advertise in. Those avenues become a lot more viable and are going to provide you with a lot more access to a population. And you also have a little bit more control in terms of getting exposure out. You're not kind of beholden to a provider. So I think there's benefits to that as well.
Got it. Thank you. And
so I'll just add a couple quick things here if you want.
Go ahead.
So it's been my experience that, sometimes providers don't know all the resources available in their communities that are there to help people. Sometimes they're very entrenched in their, medical community, but not so much maybe in their overall broad community unless that's their personality style. And so they often want to be aware of what's out there. And so it's been my experience, for example, a lot of times people get referred to Weight Watchers because that's all the doctor is aware of that's in the community. So when they know that you are out there and that you have services that can really help people, they're thrilled to pieces to know about that. Again, it's kind of hard to, make that contact to make sure they get that information. But, I've had a lot of people who have shared with me, I went to my doctor, I told him how frustrated I was, I wasn't feeling great and, I was putting on the weight and, whatever it is. And they said, well, why don't you, they'll give the person our information and say, well, I've heard good things about this class. Why don't you call them, and of course it takes a while to get to that point, but I think your physicians, whether you need their referrals or not, are a great ally because people are coming to them seeking help, and it's limited what you can accomplish in that brief doctor visit, but if they can connect you to resources in the community, most of them are thrilled to do so. And if you have specific physicians in your town that kind of have a reputation of being, wellness or prevention oriented, who, kind of walk the talk maybe more than others, I think that's a great place to start, is target those specific physicians. Because I can say for our classes, I can, name pretty quickly the physicians who are, those physicians who are telling people about our classes.
Yeah, I completely agree with Bev, and that reminded me of one other thing that I thought I would mention is that when you're sort of pitching these programs to referrals, and they are not programs that require referrals, or maybe they are, if you have data that speaks specifically to the provider's experience, I think that can be a really powerful tool. For example, with CDSMP, there's a lot of evidence around the fact that these workshops facilitate healthier and more effective communication between patients and healthcare providers. and that they also do a lot towards improving medication adherence. So if you have data like that, that really hits the healthcare provider where they live. Those things are things that are kind of immediate no-brainers to them.
Mm-hmm. Yeah. So I think having, sometimes having something that you can give to them so that they can pass that on to patients, clients, whatever, I think is a good thing if you're trying to disseminate that information through your physician. They want something tangible that they can, hand to a person and say, hey, check this out. Here's their phone number. That's been really effective for us.
Okay, another question would be, some of you spoke about, or you guys both spoke about quite a few different marketing tools you used. Some of them cost, sounds like nothing but, your time, which does cost money, but time to go speak to people, whereas others were actual marketing efforts that required cost. What did you find, what did you do, first question, to fund your marketing efforts? How were they funded? And then do you feel like for those programs that may not have as much funding available, that low cost or no cost marketing efforts can be just as effective as higher cost marketing?
Go ahead, Dominic.
For our part, time obviously time is money, so to speak. But for our part, I think to a certain extent, the lower the cost, sometimes the more effective that it's been. Because those personal touches, those provider referrals, like these are things that don't have a lot of cost associated with them. So if you're not a program that has a huge budget, but it has at least some amount of time to spend on these efforts, you can actually be very effective and you can get a lot done, and you can really focus your efforts on what for us have been the most effective means of marketing. In terms of higher cost stuff, we are funded by a handful of different grants, all of which to some extent can support our marketing efforts. And so we've been very fortunate in those respects. But as a result, I don't have a ton of insight as to how one can approach a more broadly disseminated kind of marketing effort without those kinds of funds. That's just not been our experience so far, thankfully.
Yeah, because we're part of a large hospital organization, we have been able to use some of the expertise of the local marketing team. However, really we haven't used a lot of that because our service line is not profit making. There isn't really a budget for us. But they have helped us at some, different points in time and made sure that, our materials met the, standard of identity for the organization and such. We do have this 5x9 card that's fairly, glossy in color and has some, little tidbits of information on it, which has been pretty effective. I think thinking about your pictures on your marketing material too, I think is important. Like, Dominic was saying, who is your target audience? So, looking at demographics, what is the race that you're showing on there? What's the weight? And, that kind of thing. Can people see themselves in that picture? Sometimes that's been kind of challenging for us, but you might want to, if you have a physician contact, you might even ask them what would be something that would be helpful to you, or different agencies. The little tear-off pads that I mentioned we had, they just basically, I can't even remember what they said, but they had kind of a one-line statement, and then it was our phone number in big and bold. And the reason we started making those and giving them out to doctors' offices for their exam rooms was we had a doctor that said, I just need something quick I can tear off and give to somebody. And so that's basically how we got that idea. So, maybe if you have a physician friend or something like that, or a provider or practitioner or whatever, say, hey, we're trying to make contacts with, what are your ideas for what is the best way to approach that? Or what is a low cost, marketing effort that you think that we could use for them? Because, asking them for their ideas, I think could be really effective, because we got some ideas that way.
Great. Well, thank you guys. We are at the end of our time here. Sue, would you like to make closing comments?
Sure. Thank you everyone for being here, and thank you so much to our presenters for your excellent information. I learned a lot, and I am hopeful that everyone who attended also learned a lot. We have part 3 coming up. Stay tuned for the date and time. We'll be sending that out via email to you. And please don't forget to fill out the evaluation. That helps us a lot in setting these things up and making sure that we're meeting your needs. And we'll be sending the recording out as well. Thank you all so much.